What if I told you that the hump forming at the back of your neck, the one you hide under scarves, the one that makes you look older than you are, the one you catch in mirrors and quickly look away from, is not permanent? What if everything you have been told about this condition, that it is irreversible, that it is simply part of aging, that once it forms, it is yours forever, is completely and utterly wrong? What if 3 simple exercises done in the comfort of your own home, without any equipment, without any surgery, without spending a single dollar on expensive treatments, could begin to visibly reduce that hump starting within just a few weeks? What if your spine has been waiting for you to give it exactly the right signals and nobody ever told you what those signals were? What if today is the day everything changes for your posture, your confidence, your health, and your future? Stay with me through every single second of what comes next, because what you are about to learn is going to shock you, it is going to challenge everything you assumed was fixed and broken, and it is going to hand you back control of your own body in a way you never thought possible at any age. What if the hump growing at the back of your neck is not a life sentence? What if it is actually your body sending you a distress signal? A signal that has a clear, documented, scientifically backed answer that most people are simply never given access to? What if the difference between carrying that hump for the rest of your life and standing tall, straight, and pain-free comes down to 3 exercises that take less than 15 minutes of your day? I want you to stay with me because what follows in this presentation is not guesswork, it is not general fitness advice, and it is absolutely not the kind of surface level information that leaves you more confused than when you started. What you are about to receive is a deep, precise, clinically informed breakdown of exactly what Dowager's hump is, exactly why it forms, and exactly what you need to do to begin reversing it, regardless of how old you are, regardless of how long you have had it, and regardless of what anyone has told you before today. Let us begin with the truth that almost nobody wants to say out loud. The hump you see at the base of your neck and the top of your upper back, the one medically referred to as Dowager's hump or kyphosis, is not simply a cosmetic problem. It is a structural alarm. Your spine is one of the most intelligently designed systems in the entire human body. It has 33 vertebrae stacked in a precise, carefully balanced column, and every single one of those vertebrae depends on the muscles, ligaments, and daily habits surrounding it to stay in its correct position. When that system is disrupted, and in today's world it is being disrupted at an epidemic level, the spine begins to compensate. It begins to curve forward. The vertebrae of the thoracic spine, which is the middle and upper portion of your back, begin to compress at the front and open at the back. The muscles of your chest become shortened and tight. The muscles of your upper back become elongated and weak. And the body, in its desperate attempt to keep your head balanced above your center of gravity, begins to deposit a pad of fat and connective tissue at the base of the neck, because it is trying to stabilize a structure that has lost its natural alignment. That deposit, that rounding, that bump that you feel and see and perhaps have been ashamed of, that is Dowager's hump. And understanding that it is a compensation mechanism, not simply a consequence of getting older, is the first revolutionary thing I need you to absorb today. Now here is where it gets shocking, and I mean genuinely shocking, in a way that should make you sit up straighter right now in whatever position you are currently in. Research has demonstrated that Dowager's hump is not exclusively a condition of elderly women. It is increasingly being diagnosed in people in their 20s, 30s, and 40s. The explosion of smartphone use, the normalization of 8 to 10-hour desk jobs, the way modern furniture encourages passive slouching, these cultural shifts have accelerated spinal deterioration at a rate that medicine is still struggling to keep pace with. A teenager who spends 6 hours a day looking down at a phone is placing approximately 60 pounds of force on their cervical spine with every degree of forward head tilt. 60 pounds, on a structure that was designed to bear approximately 10 to 12 pounds. Do that day after day, year after year, and you will create the structural conditions for Dowager's hump long before middle age arrives. The hump does not care about your age, it cares about your habits. And that is both the most alarming thing I can tell you and simultaneously the most empowering. Because habits can be changed. Let us talk about what is actually happening inside the body when this condition develops, because this level of understanding is what separates people who do random exercises and see no results from people who follow a targeted protocol and experience real, visible transformation. When the thoracic spine rounds forward excessively, several things happen in cascade. The intervertebral discs, which are the cushioning pads between each vertebra, experience uneven pressure. The front of each disc is compressed while the back is stretched. Over time, this uneven loading can cause the disc to dehydrate, to lose height, and to contribute to the permanent-looking forward curve that people assume is irreversible. Simultaneously, the muscles of the posterior chain, specifically the rhomboids, the middle and lower trapezius, and the deep cervical flexors, become progressively weakened from chronic lengthening. They are essentially being pulled apart all day long and never given the chance to reset. Meanwhile, the opposing muscles, the pectorals, the upper trapezius, the suboccipital muscles at the base of the skull, become dangerously tight and overactive because they are doing the compensatory work of holding your head up in its misaligned position. This muscle imbalance creates a self-reinforcing loop. The tight muscles pull you further forward. The weak muscles cannot resist. The spine curves more. The hump grows more pronounced. And the longer this continues without intervention, the more the connective tissue and fascia adapt to the dysfunctional position, making it feel like the new normal, making it feel wrongly like it cannot be undone. But here is the extraordinary thing about human tissue. It is adaptive. Your muscles, your ligaments, your fascia, even the remodeling of bone over time, all of it responds to the signals you consistently give it. And the 3 exercises I am about to walk you through have been specifically chosen because they address every single component of this dysfunction simultaneously. They are not random exercises. They are not general stretches you find in a basic yoga class. They are targeted, biomechanically precise movements that directly counteract the exact pattern of dysfunction that creates and sustains Dowager's hump. Each one has a specific role. Together, they form a complete corrective protocol. And the research behind postural correction consistently shows that people of all ages, including people in their 70s and 80s, can experience meaningful improvement in spinal curvature, reduction in the visible hump, significant decrease in associated pain, and dramatic improvement in overall function when they commit to this kind of targeted, consistent practice. The first exercise is the chin tuck, and I need you to understand this movement at a level far deeper than its simple appearance suggests, because most people who attempt it are doing it incorrectly and therefore getting almost none of its benefit. The chin tuck is not about pushing your chin down toward your chest. It is not about lowering your head. It is a retraction movement, a drawing back of the head along a horizontal plane, as if the back of your skull is being gently pulled straight backward by an invisible thread. When performed correctly, you will feel a deep stretch at the very base of your skull, at the suboccipital region, and you will simultaneously feel the deep cervical flexor muscles, the longus colli and longus capitis, activating along the front of your cervical spine. These muscles are critically important. They are the primary stabilizers of the cervical spine, and in virtually every person with Dowager's hump, they are profoundly weakened from years of forward head posture. Think of them as the internal corset of your neck. When they are strong, your head sits directly over your shoulders in perfect balance. When they are weak, your head drifts forward, adding that catastrophic extra load to every structure below it. To perform the chin tuck correctly, you sit or stand with your spine in as neutral a position as possible. You look straight ahead, and you slowly draw your head straight back. Not down, not up, straight back, until you feel that stretch at the base of the skull and the gentle engagement at the front of the neck. You hold this position for 5 full seconds, breathing normally, feeling the muscles work. Then you release slowly. You repeat this 10 times. What sounds almost laughably simple is actually one of the most powerful repositioning signals you can send to your cervical spine. Over time, with daily practice, this movement begins to restore the natural cervical lordosis, the gentle inward curve of the neck that is supposed to be there and that forward head posture destroys. Restoring cervical lordosis is not a cosmetic outcome. It is a functional restoration that reduces nerve compression, decreases headache frequency, improves balance, and directly addresses the forward head component that contributes to the appearance of the hump at the neck-thoracic junction. The second exercise is thoracic extension over a foam roller, and this one has the potential to produce the most immediately noticeable visual change of all three movements, because it directly targets the structural curve of the thoracic spine itself. The thoracic spine is supposed to have a gentle kyphotic curve, meaning it is naturally slightly rounded. But in people with Dowager's hump, this curve has become excessive, rigid, and locked into a flexed position that the surrounding tissue actively resists changing. The foam roller acts as a fulcrum. When you position it horizontally beneath your thoracic spine and allow gravity and your own body weight to gently guide your upper back into extension, into backward bending, you are applying a sustained, controlled force directly to the locked segments of the spine. You are introducing movement into joints that have been progressively stiffening for potentially years or even decades. To perform this correctly, you place the foam roller on the floor and sit in front of it. You lower yourself so that the roller is positioned at approximately the level of your shoulder blades. You support your head with your hands, you allow your knees to bend with your feet flat on the floor, and you gently allow your upper back to drape over the roller. You breathe deeply and allow gravity to do its work. You can slowly roll the foam roller up and down through the thoracic region, pausing at any segment that feels particularly stiff or tender. That stiffness and tenderness is information. It is telling you exactly where the dysfunction is concentrated. You spend approximately 1 to 2 minutes in this position, moving slowly and mindfully. What is happening biomechanically is profound. The anterior longitudinal ligament along the front of the spine is being gently lengthened. The compressed disc spaces are being given the opportunity to rehydrate as the pressure is temporarily reduced. The costovertebral joints, the tiny joints where your ribs attach to your thoracic vertebrae, are being mobilized, which has a direct and immediate impact on your breathing capacity. And the proprioceptive signals being sent to your brain are telling your nervous system that extension in the thoracic region is safe, available, and something the body should begin to accept as a new baseline. People consistently report that after just a few sessions with this exercise, they feel taller, they feel looser through the upper back, they feel like they can take a deeper breath, and that is because all of those things are literally true. The spine has been moved into a position it has not visited in a very long time, and the body remembers. The third exercise is wall angels, and this is where the strengthening dimension of the protocol comes into its full power. Because here's the reality that many people miss entirely. You can mobilize the thoracic spine all you want, but if you do not simultaneously strengthen the muscles that are supposed to hold it in its corrected position, the spine will simply return to its dysfunctional posture the moment you stand up and go about your day. The muscles need to be trained to do their job again. Wall angels directly target the rhomboids, the middle trapezius, the lower trapezius, and the serratus anterior, all of which are chronically inhibited and weakened in people with Dowager's hump. To perform wall angels, you stand with your back flat against a wall. Your heels should be a few inches from the wall, your sacrum should be against the wall, your thoracic spine should be against the wall, and critically, the back of your head should be against the wall. This is already a postural correction that many people find surprisingly challenging. You raise your arms to a 90-degree position so that your upper arms are horizontal and your forearms are pointing upward, with the backs of your arms, your elbows, and your wrists all in contact with the wall. This is your starting position, and already the muscles of your upper back are working to maintain this contact because this is the position they have been neglecting. From here, you slowly slide your arms upward along the wall, raising them above your head as far as you can go while maintaining contact between your back, your arms, and the wall. The critical point is that you must not allow your lower back to arch excessively, your ribs to flare, or any part of your arms to lose contact with the wall. When you can go no further while maintaining these contacts, you slowly lower the arms back to the starting position. Each repetition should be slow, controlled, and deeply intentional. You will feel the muscles between your shoulder blades working hard. You will feel the lower trapezius, the muscle that anchors your shoulder blades downward, engaging in a way that may feel entirely unfamiliar. You will feel the challenge of keeping your head against the wall, which is the deep cervical flexors working in integration with the shoulder girdle muscles. 3 sets of 10 repetitions of wall angels, done with this level of precision and awareness, is an extraordinary stimulus for the muscles that are supposed to prevent and reverse the postural collapse associated with Dowager's hump. Now, I want to address something directly because I know the question that is forming in many minds right now. You may be thinking, can this actually work for me? Because your hump feels solid, it feels structural, it feels like bone, and you have perhaps been told by someone along the way that nothing can be done. I want to dismantle that belief with the precision it deserves. Yes, in cases of severe, long-standing osteoporotic kyphosis, where actual vertebral fractures have occurred, the structural component of the curve is significantly more fixed. But the vast majority of people with Dowager's hump have a condition that is primarily driven by soft tissue changes, muscle weakness, muscle tightness, fascial adaptation, and habitual movement patterns, all of which are highly responsive to the right interventions. Even the fat pad that forms at the base of the neck, which many people believe is permanent, has been demonstrated to reduce significantly when the underlying postural dysfunction is corrected and proper movement is restored. The body is not trying to keep you in pain and dysfunction. The body is doing its absolute best with the information and demands you are giving it. Change the demands consistently and correctly, and the body will change its response. Consistency is the variable that determines everything. These exercises must be done daily. Not 3 times a week when you remember, not occasionally when the neck pain gets bad enough to motivate you. Daily. The tissues that need to change have been adapting to dysfunction for months or years. You are asking them to relearn patterns that feel unfamiliar and effortful. That process requires repeated, regular input. Research in postural rehabilitation consistently points to a 4 to 6 week window as the point at which most people begin to see and feel meaningful change, and 12 weeks of consistent practice as the point at which those changes become deeply established in the nervous system and the tissues. 15 minutes a day for 12 weeks. That is the investment. Set it as a non-negotiable part of your morning or your evening. Pair it with something you already do, your morning coffee, your evening wind down. Build the habit with the same seriousness you would give any other health intervention, because the stakes are genuinely high. Untreated, progressive Dowager's hump is not simply a cosmetic concern. It is associated with significantly increased risk of falls and fractures in older adults. It is associated with chronic nerve compression, leading to radiating pain, numbness, and tingling in the arms and hands. It is associated with restricted lung capacity because the rounded thoracic spine physically limits the expansion of the rib cage. It is associated with disrupted sleep, persistent headaches, and a progressive loss of independence and quality of life that no one should have to accept as inevitable. Your posture is not just about how you look. It is about how you breathe, how you think, how you move through the world, how confident you feel in your own body, how much pain you carry, and ultimately how long you are able to live with full function and dignity. The 3 exercises you have learned today, the chin tuck, the thoracic extension over a foam roller, and wall angels, are not a quick fix. They are the beginning of a relationship with your spine that, if you honor it consistently, will give you back something that no surgery can replicate and no medication can provide. Genuine, earned, sustainable structural health. What began as a question, what if this hump is not permanent, has been answered today with evidence, with anatomy, with practical tools, and with the kind of honest, detailed information that respects your intelligence and your desire to genuinely heal. Dowager's hump is not your destiny. It is a pattern. And patterns, when approached with the right knowledge and the right consistency, can be interrupted, reversed, and replaced with something far better. You now know what is happening inside the spine when this condition develops. You now know exactly why the 3 exercises chosen today work at a biomechanical level. You now know how to perform each one with the precision that produces real results rather than wasted effort. And you now know that this journey, regardless of your age, regardless of how long you have carried this condition, is one worth beginning today. Not tomorrow, not next week, today. Your spine has been waiting for this. Your posture has been waiting for this. Your future self, standing taller, breathing deeper, moving freer, living with less pain, has been waiting for this. The only thing that changes from this moment forward is your decision to act on what you now know. The critical point is that you must not allow your lower back to arch excessively, your ribs to flare, or any part of your arms to lose contact with the wall. When you can go no further while maintaining these contacts, you slowly lower the arms back to the starting position. Each repetition should be slow, controlled, and deeply intentional. You will feel the muscles between your shoulder blades working hard. You will feel the lower trapezius, the muscle that anchors your shoulder blades downward, engaging in a way that may feel entirely unfamiliar. You will feel the challenge of keeping your head against the wall, which is the deep cervical flexors working in integration with the shoulder girdle muscles. 3 sets of 10 repetitions of wall angels, done with this level of precision and awareness, is an extraordinary stimulus for the muscles that are supposed to prevent and reverse the postural collapse associated with Dowager's hump. What began as a question, what if this hump is not permanent, has been answered today with evidence, with anatomy, with practical tools, and with the kind of honest, detailed information that respects your intelligence and your desire to genuinely heal. Dowager's hump is not your destiny. It is a pattern. And patterns, when approached with the right knowledge and the right consistency, can be interrupted, reversed, and replaced with something far better. You now know what is happening inside the spine when this condition develops. You now know exactly why the 3 exercises chosen today work at a biomechanical level. You now know how to perform each one with the precision that produces real results rather than wasted effort. And you now know that this journey, regardless of your age, regardless of how long you have carried this condition, is one worth beginning today. Not tomorrow, not next week, today. Your spine has been waiting for this.